A charming older couple from South Africa who are getting acclimated to a new life. A woman who has lost insurance and hasn't seen a doctor in a while. A young college graduate who has a new job. A hard-working man who seldom missed a day of work until he was injured. People with very different backgrounds, but a common problem. Where to find the medical home they need in a complex healthcare landscape. And for thousands of people, the Community Health Center of the New River Valley is the place they turn.
We were very nervous when we went for the first time. You know, being a new place, new people, new country, new environment. And they put us at ease immediately. And they acted very professionally.
I've always been used to having my own doctors, my own insurance. So I was kind of like, you know, how's this going to be? I was very pleasantly surprised.
I was born visually impaired, so because of that I have Medicare, which doesn't cover dental cost, so I can go to the community health center for a much lower rate than a regular dentist.
I worked maintenance in the dorms for Virginia Tech. Did that for about 6 or 7 years. Budget cuts came in about 2010, 2011. Unfortunately, I was laid off. But there was an opening at the Virginia Tech power plant. So I got a job there raking the ash out of the boilers that they have. I happened to hurt myself doing that, and I haven't done much since then.
We are now the Community Health Center of the New River Valley, and what that means is we're still true to our original mission. We serve those in our area who are uninsured, who don't have any health insurance at all. But now we can also serve those who are underinsured, those who have Medicare, Medicaid coverage, and those who have third-party insurance.
We're in the same building. We have a lot of the same patients, a lot of the same staff. The reason why we want people to come to the center because we're not going anywhere. We're here, we're improving. With improvement comes change. With change comes challenges. But our hope is that this is all for the betterment of the community. And it's as simple and as cut and dry as that.
It's really a team approach with us. It's not one provider making a decision. You know, it's the patient is kind of the center of the team. And then around the patient, we have this team of doctors and providers that we all have our different expertise that are working together for the best care.
I get 3 kinds of treatment there now. I get the mental health treatment that they give me since the injury itself, and now I'm going to get dental there. It's a one-shop everything.
The words getting better can mean different things. When you're sick, it means returning to health. When you're well, it means improving your outlook or well-being. For an organization, it means expanding your capacity and refining your craft. For a community, it's seeing that everyone's needs are provided for and that the future will be better than today.
It's a wider scope of practice, which means more challenging patients due to their financial or living situations. Makes things different, and you get a chance to really put into practice all the things that you not only learned textbook, but in art of medicine as well.
Everybody's been kind and nice, and they're like family to me. They become part of your life. They've been wonderful and so helpful to me. God bless them.
There are 2 things that I think are really important for choosing a volunteer opportunity and that make them really rewarding. And I think the first one is having a mission, an organizational mission that's really passionate, that you can be passionate about. The second thing I think is really important for a rewarding volunteer opportunity is to work with a really well-run organization. And we've got a great staff at the Community Healthcare Clinic, so I think it's a privilege and a joy to join the staff and try to provide care to the patients in our area.
Now that I'm retired, one of the really nice things for me personally is that I still have an opportunity to be involved with women and with their health care and get to know people and you know, have that conversation.
I know we're doing the right thing. We are in the community. It's the community's health center. And we are here to provide the services for those people who live in our community.
If we could encourage other people to assist them, it's for such a good cause. Do it.
In many ways, getting better is what life is all about. The Community Health Center of the New River Valley believes in getting better for our patients, our organization, and our community.
We go through changes when we're in pain, when we get hurt. You aren't the same person anymore. You're now fighting an injury. They understood that. They took care of that for me.
I was having some sensitivity with my teeth, and so I went there and I had a small cavity and I got 2 fillings. They even held my hand.
The doctor was absolutely wonderful. Took me back, talked to me for about 45 minutes. I mean, went over everything from head to toe. Asked me when was the last time that I'd had a mammogram. I said 2009. He said, well, that's the first thing we're going to get done. And within 4 to 5 weeks, I was in having a mammogram, and thank the Lord, it happened when I did, because they found out that I had breast cancer and I had to have a mastectomy. In my situation, if I had not been able to go there, I think it would have been a lot different story, than what I'm sitting here saying now, because I think I probably wouldn't have found out about my cancer until way in a later stage. So I'm very thankful that I was able to get there.